Hi all, this is Dr. M. Malarvili, Assistant Professor and Head, Department of Chemistry, Sri GVG Visalakshi College for Women, Udumalpet. Today we shall see about anti-malarial drugs. Malaria is an serious and infectious disease caused by a parasite known as Plasmodium. Actually, there are 5 different types of Plasmodium parasites that can cause malaria in human beings, which includes Plasmodium falciparum, Plasmodium vivax, Plasmodium malaria, Plasmodium ovale, and Plasmodium knowlesi. Actually, this malaria is coming to us through the mosquito bite. Yes, you are hearing it right, through mosquito bite. Actually, Anopheles female Anopheles mosquito, if they has got any Plasmodium species in them, that is, if they are infected by Plasmodium species, and if we got bitten by that mosquito, then Plasmodium species will be transmitted to us. So, Plasmodium species is typically transmitted through bite of an infected Anopheles mosquito. Now, what are the signs and symptoms of malaria? Symptoms of malaria are very similar to symptoms of flu. For example, fever, sweating, chills that shake your whole body, headache, muscle aches. Eating may cause fatigue, may induce chest pain, breathing trouble, and cough, and sometimes diarrhea, nausea, and vomiting. If the condition is worse, there may be some life threatening complications of malaria, like swelling of the body, that is, swelling of the blood vessels of the brain, accumulation of fluid in the lungs that causes you breathing troubles, failure of kidney, failure of liver, and failure of spleen. Sometimes anemia, because there will be destruction of red blood cells during or if we have got any malaria. And another common complication is low blood sugars. Now let us move on into the classification of anti-malarial drugs. Anti-malarial drugs, these are the drugs which are used to treat malaria. And according to anti-malarial activity, that is according to their biological activity, anti-malarial drugs can be classified into 4 types: tissue schizonticides, blood schizonticides, gametocytocides, and sporontocytes. And these antimalarials can be classified into 3 broad categories based on their chemical structure and mode of action. Number 1, aryl amino alcohol compounds. Examples: quinine, vinidine, chloroquine, etc. Number 2, antifolate compounds. Example for antifolate compounds: pyrimethamine, proguanyl, chloroproguanyl, etc. Number 3, artemisinin compounds. Example: artemisinin, dihydroartemisinin, etc. But we have to understand that no single drug can completely cure malaria. It is not yet discovered. So, in practice, one or more classes of drugs are often given at the same time to fight against malaria. And here is one table which consists of the chemical classification of anti-malarial agents. Number 1, cinchona alkalides. Derivatives are given in column 2, that is followed by serial number in derivatives column, and another third column is examples. Number 1 row, Synhonoalkalides, example quinine, synhonine, etc. Number 2, 7-chloro-4-aminoquinolines, example chloroquine, hydroxychloroquine, quine, that is okay. And number 3, 8-aminoquinolines, example primaquine, palmaquine, etc. Number 4 is acridine derivatives, that is 9-amino acridine derivatives, example quinacrine, acriquine, etc. And number 5 is biguanides, example proguanyl, chloroproguanyl, etc. Number 6, diaminopyrimidines, example pyrimethamine. Number 7, sulfonamides and sulfones, sulfadoxine, examples sulfadiazine, sulfamethoxazole, sulfoline, etc. And number 7, any other miscellaneous drugs will fall under the seventh criterion, example halofantrine, mefloquine, etc. And we shall see about synthesis of two antimalarial drugs, chloroquine and Primaquine. Chloroquine. It is the prototype anti-malarial drug and it is mostly used to treat all types of malarial infections. It is very cheap and it is very safe. It is highly effective against erythrocytic forms of Plasmodium vivax, ovale, malaria and to some sensitive strains of Plasmodium falciparum. Let us see the synthesis of chloroquine. Chloroquine can be synthesized by condensation of two products. One, that is 4,7 dichloroquinoline when it is condensed with 1 diethylamino 4-aminopentane. Then it will give you chloroquine. See, here you can see a quinoline. Yes, compound where in the position 4 and 7 there are two chlorine atoms. So 4,7 dichloroquinoline, it is condensed with 1 diethylamino 4-aminopentane. There is removal of HCl. Then our chloroquine is obtained. Now uses of chloroquine. Chloroquine, we know it is used in the treatment of malaria. It can also be used to treat liver infection, hepatic amoebiasis, light-sensitive skin eruptions, and sometimes rheumatoid arthritis can also be treated using this chloroquine. Chloroquine may also be used to treat coronavirus, it seems. And next one, synthesis of primaquine. Primaquine is an antimalarial agent and actually it is used as a co-drug with chloroquine in treating all types of malaria. Yes, and especially it is used to treat malaria due to Plasmodium vivax and Plasmodium ovale. It is a most effective drug. Though it is most effective, it is also said to be most toxic when you compare in the series of 8 aminoquinolines. Right. The structure of primaquine is also given here. About the synthesis of primaquine. The other name, not other name, the chemical name of primaquine, it is given here 8,4-amino 1-methyl-butyryl amino 6-methoxyquinoline. Actually, it is a quinoline, right? So, primaquine, it is obtained. We can see here, primaquine is obtained from 6-methoxy-8-nitroquinoline. 6-methoxy-8-nitroquinoline is the basic thing. So we are going for one quinoline compound. In quinoline, in the 6th position, one methoxy group and 8th position, one nitro group should be there, right? How come? This compound is obtained using one scrap synthesis where 4-methoxy-2-nitroaniline is treated with glycerol, CH2OH, CHOH and CH2OH. So 4-methoxy-2-nitroaniline on treated with glycerol in presence of sulfuric acid, it will result in the formation of 6-methoxy-8-nitroquinoline. Okay. So this 6-methoxy-8-nitroquinoline on reduction using iron in presence of HCl the nitro group will be reduced to amino group. So now we have got the product 6-methoxy 8-aminoquinoline. Okay. So 6-methoxy 8-aminoquinoline, when it is treated with 4-bromo 1-thaliimidopentane. See, kindly see the structure. It is given there 4-bromo 1-thaliimidopentane. When these two react, it will be resulting in the formation of 8-4-thaliimido 1-methylbutyryl amino 6-methoxyquinoline. Okay, so here when you proceed with hydrazinolysis, right? This thalamide protection will be removed. So it will be forming primaquine. So from 8,4-thaliimido 1-methylbutyryl amino 6-methoxyquinoline, it will be resulting primaquine, which is nothing but 8,4-amino 1-methylbutyryl amino 6-methoxyquinoline. Now uses of Primaquine. Primaquine is used to treat malaria, we know, and also it will protect us from coming back after treatment. Okay, it will protect us from the relapse. Yes, thank you for your listening.